Hello, I'm Dr. Mike Zweifler, better known as Dr. Z. Thank you so much for your interest in the Soft Stick product, and why don't we go back into the operatory and let me give you the simple training today. What do you think?
Great.
Great. All right, Casey, are you ready for your training in Soft Stick?
Absolutely.
All right, I'm going to make this very simple. There are basically 3 steps we're going to follow, and if you'll put your hand up here, I always like to start the training somewhere on the arm where it's visible so that the patient or the learner can see exactly what's going on. Similar to the tenting procedure that has been used for years, instead of doing that, our tips come individually wrapped, and these are clean. So we take a disposable tip out of the package. Now these are disposable, so they're one use and they go away. We never reuse them. The wand is turned on, and if you notice now it has a little rocker switch here with a plus and a minus, so the top one turns it on and then the bottom one snaps it off. So we're going to engage the wand, and then this is important, you don't need to mash the top onto the motor because remember it has to come back off.
Yes.
So just a nice press fit and it'll hold itself in position. Our needle, obviously the top is taken off, so now that we know the needle is used, or we assume it's used. And the motor, this is another very important thing. The motor is not just simply grabbed like the handle of a bicycle. It's grabbed like the handle of a bicycle, only you choke up on it so that your finger will actually engage the conical portion of the disposable tip. What this does is it creates a nice stability, and if you notice what I'm going to do is I'm going to grasp the tissue with my thumb, and if the tissue were very slippery, we would be not able to grasp the tissue. Now I want you to, when you do me next, which is going to be your part of the training, if you notice I'm pushing enough pressure on here to fire the afferents to your brain.
Yes, sir.
So now we have vibration and we have the afferent nerves blocked.
Yes,
and honestly, here you go. The needle's simply inserted at a 90-degree angle through the tip. And be honest with me, I mean, did that hurt at all?
Absolutely not.
Tell me the truth,
promise.
because we don't want you to sugarcoat it. The motor's turned off, the tip is obviously disposed, the needle goes in the sharps, the area is wiped clean, and if necessary, a bandage can be applied. And honestly, the hardest part of this whole procedure will probably be taking the Band-Aid off.
There you go. Hey, that is wonderful. Absolutely no questions. You did a great run through with that.
Okay.
I am not a fan of needles, and that was wonderful. I did not feel it at all.
All right, what is the first thing we do?
First thing we need to do is clean the
Okay.
injected area.
Okay, so we're going to prepare the skin. And why are we doing this now?
To rid it of any oils, lotions,
Okay.
any kind of bacteria that can be next to the
Great.
injection
And we'll
site.
just give it a quick dry. And then you'll open up your new tip, which is again disposable. And the nice part, coming individually packed, you can tell that, you know, if you have them in a box, don't have somebody touching 5 at the same time.
Absolutely.
Okay, you're going to engage it on the motor, just press fit it.
Not very
Okay.
snug.
Not too snug. 'Cause remember, you're going to have to take it off. You don't want it to stick on there forever.
Absolutely.
Now the top button is your on button. The bottom button is your off button.
It's your off button. Now
And then we're going to go ahead and take the tip of the needle off so we know it has not been used. And again, now you are right-handed,
Yes, sir.
so you're going to go ahead and what, with your left
With
hand?
my left hand. Yes,
Okay.
sir.
Now hold it flush against the skin.
I'm going to get a real snug fit, right?
And then you want, remember, you want this flat against the skin. And we're going to put your thumb there. Now you're going to go ahead and pinch. Good. Get a real good grasp. Do you see now why it's so important? Here's your needle.
Yes, sir.
Do you see why it's so important now to have the skin dry?
Yes, sir.
Otherwise the skin would keep slipping.
Slipping,
Yeah,
yes,
and we
sir.
want it nice and secure. Pinch real hard
At a 90-degree angle.
and 90-degree through the hole, and then just leave it there. Is that great? And I'm like you. Needles, I mean,
Not a fan.
no, I'm always giving them, but I don't get them that often. And there we go. Now wipe the area. See, you got a little bit of blood, so we know it's not a trick needle.
Yes, sir.
And then why don't we put a Band-Aid on there just for good measure. Terrific.
Couldn't be
Okay.
any better, Swaffler.
Thanks, Casey.